There are so many people that when they want to give birth, they are unconscious.
Okay. Hello, thank you for joining us on Nobu TV Live. My name is Craig Mona, and we are on the medical lane this time around, and we're looking at safety of maternal birth. And our guest is a professional midwife, an individual that you would love to actually have in terms of giving advice, counseling on the areas relating to maternal life and also Chin Sindiri Wankwa. You're welcome.
Yeah, thank you, sir.
Okay. So, madam, it's very interesting to have you on this program.
Thank you.
Because many people will be very watchful, trying to get information on a vital area of life. Because if there's no life, there will be no human society.
Yes.
And what precedes life. So, can you help us educate the viewer on the issue of safety of maternal birth?
Okay, thank you. The issue of maternal birth is there are so many things that the society neglects when it comes to health and when it comes to childbirth and when it comes to the midwives. They look down on them because they think they don't have the power or the right, or they don't have the adequate infrastructures.
Okay.
So I would say that when it comes to maternal birth, the challenges and the problems that midwives are having are inadequate infrastructure and the society making healthcare a national priority.
So now because it's a very tricky area, for the relatively speaking, the novice. What can we say are those things taken for granted?
Okay.
Yes, and especially as it affects, the experience of giving birth, because it's a very sensitive area of social life, giving birth. But maybe those that are principally involved, at the prenatal stage, prematernal stage phase, the taking for granted, and outside the knowledge of the midwife. Because as things are, adaptive society will live without the midwife. It's basically introductory, to managing human life. So, what are those things taken for granted? How do they affect, maternal birth?
Okay, the things that are being taken for granted that actually affect the midwives are not providing the necessary things being needed. Things like equipment for childbirth, bed, and so many other things that involves life. And another one is lack of staffs.
Okay. Personnel.
Yes. Before you become a midwife, there are so many things that are involved in it.
Okay.
You have to have patience, because a pregnant woman can walk in and start behaving anyhow. It's not actually
her fault.
Her fault.
Okay.
It's the pain and how she feels. So it only takes a midwife that understands what it takes to be pregnant and the outcome of being pregnant. As in, it only takes a patient midwife and someone that can tolerate.
Okay.
You must tolerate and you must have a listening ear.
Okay.
Yes.
By the patients.
Yes.
So, what about counseling?
Yes, there's so many people that when they come for antenatal, all these things, and you want to sit them down and counsel them, tell them things and things not to do, they will end up telling you that they know more than you. So what is required then is what is called patient. It's you make them your friend so that they can be able to tell you what is going on and what they are experiencing. So that is it.
Okay. So how does the midwife, relate or connect with the physician in ensuring that yes, birth is safe and free from any kind of eventuality that nobody will like?
Okay, it also only takes the grace of God to do that.
Okay.
Yes, because when you want to convince someone about his or her life, it doesn't only take your power. You have to ask other people around. You need a helping hand. Nobody knows it all. So for you to convince the pregnant woman or pregnant women on what to assure them their safety, you have to get along with them first, relate with them well, tell them what and what to do at each given time, make friends with them more importantly, then lecture them on things that are very harmful to them and things that are not.
Okay.
So that's
okay. There's always a recurring decimal, in this cycle of ensuring that maternal birth is free from any bad eventuality. That is when the pregnant woman experiences stillbirth. The baby does not come out, anxiety at the parental level, in extended family, what is happening? So how does the midwife handle that kind of situation?
okay. How midwives, that is why midwives need proper equipment, nice equipment, that when it comes to that stage, you will know what and what to do. When a pregnant woman has difficulty in pushing out the baby,
Okay.
it only takes a brave midwife and someone that is experienced
Courage.
and courage on what to do at that particular time.
Okay.
So when it comes to level of the woman giving birth and she can't push out, there are what is called hanger. It's called hanger.
Okay.
You can put it on the woman's two legs so that it can be easy for her to push. And she also needs your help and your motivation on doing that, because you'll be the one to direct her on what to do.
That's a pregnant woman.
Yes.
Okay.
Yes, a pregnant woman can give birth
But
to.
at that stage, when the hanger is fully, in place,
Yes.
the pregnant woman under that pressure of pushing and still nothing is,
Coming out.
Yes. Will she attain that level of, presence of mind to be, to suggest to the professionals, this is how I want it? That rationality, will she still attain it?
It
Because it's under
depends.
pressure.
It depends on the individual.
Okay.
There are so many people that when they want to give birth, they are unconscious.
Okay.
There are so many that are conscious. There are so many that knows what happens around them, and there's so many that doesn't know what happened. So if you're in the situation of the person that doesn't know what's happening,
Yes.
it only takes your colleagues, that is the people around, the staffs,
Okay.
to put hands together and know what to do at that point. Yes.
Okay.
But when the woman knows the woman that is giving birth knows what is happening, it also is even easier. It helps you to know that this is where and where there is difficulty.
Okay.
So that is just when you as a midwife will now come in, like tell her, oh yeah, see how we're going to do it, and she will follow your instruction.
Okay.
So the best is the woman being conscious and knowing what is happening around her at that particular time. It helps a lot.
So this piece of advice you're giving, have you actually practiced it in your professional life from time to time?
Yes, I have.
You get good results?
Yes, I did. As of, that was last month,
Okay.
we had a very complicated issue at a ENU teaching hospital.
Okay.
I went there. So at that stage, the woman was unconscious. So the midwife, although I didn't learn, I didn't learn that, but I learned it that day, because the midwife there is an old hand. So I call her my mentor.
Okay.
So when it was happening, then we do shout, push, but the woman was like, no, for now, that is not what she needs now. That what she needs now is words of encouragement. So when she actually brought out that idea, this woman, they've been saying push, push, and she was very weak to the extent of everybody around was like, we don't know what else to do. Then when the woman came in, she just talked to her. Madam, you can do this. It's only you that can do this. You can help us. So just those words of encouragement. Before 2 minutes, the woman has already pushed out. So I took that as a personal knowledge that I learned that day, that actually these women need encouragement. They need petting, and they don't need petting sometimes, because sometimes when you pet them, it seems like the only thing that the midwife can do is just to pet. There's sometimes when you see that the matter is going out of hand, you have to shout, you have to be mean to her, to tell her that it's your life that we are talking about here. So you help yourself, I help you. So that is just it.
Okay, so I'm sure you did stay glued to Noble TV at this juncture, because we've been talking about what concerns the cycle of human life, whether it's Africa, whether it's America, Australia, India, China, coming to being as a human being. And a professional midwife, Chinsindiri Mankwo, has given cause for us to feel and is much better attuned, to the experience of, giving birth, because she has educated us on the intricate areas, and she says it is important for experience, patience, and also on the part of the woman, giving birth, to be responsive to the various counseling methods. Thank you very much, madam.
Thank you, sir.
Remember the cycle, you like, watch, and also subscribe. Noble TV is always there for you. Don't fail, to stay glued to your preference. My name is Gray Admonitor.